My report today is going to be on asthma and how it can be controlled. The reason why I thought about this topic is because my son has asthma. His trigger is actually when he gets cold. So asthma is a chronic lung disease of the respiratory system. There is an inflammation of the air passages that result in a temporary narrowing of the airways that carry oxygen to the lungs. It affects more than 25 million Americans and causes almost 2 million emergency room visits every year. The public needs to be better informed and educated about the effects of asthma and the ways it can be controlled. Every individual with asthma has their own specific triggers. Some of the known triggers of asthma are exercise, airborne allergens, airway infections, and tobacco smoke. Exercise-induced asthma may cause an asthma attack in people who have no other triggers and do not experience asthma under any other circumstances. The trigger is rapid movement of air into the lungs before it is warmed and humidified. People with exercise-induced asthma are believed to be more sensitive to changes in the temperature and humidity of the air. The triggers caused by airborne allergens are mold, dust mites, cockroaches, animal dander, and pollen. Mold flows through the indoor and outdoor air continually, lands in damp places, and begins to grow. Inhaling the spores can trigger an attack. The body parts and droppings from dust mites can trigger asthma in individuals with allergies to dust mites. If a person with asthma has cockroaches in their home, they must get rid of them. If not, they can find themselves having more attacks than normal. If someone has an allergy to pets with fur, the best option is to get rid of the pet, or the dander can cause an attack. It is very hard to avoid pollen because it cannot be eliminated from the atmosphere. It is very important for all asthma sufferers that are allergic to pollen to make sure that they are taking their allergy medications as well as their preventative asthma medications in order to prevent an attack from occurring during the months of February through October. Airway infections such as sinus infections, colds, the flu, and respiratory virus trigger asthma. When sinuses get inflamed, their airway responds similar in many people with asthma. The infections can be viral or bacterial. It causes the airways to easily narrow as long as 2 months after an upper respiratory infection. Many scientists have found a link between the common cold and worsening asthma symptoms. The virus usually will still be present in the upper airways as well as deep inside the lungs if one has the common cold. The last trigger of asthma is tobacco smoke. The irritating substance settles in the moist lining of the airways, causing an asthma attack. It damages the cilia located in the airways, allowing dust and mucus to accumulate in the airways. That makes the lungs create more mucus to build up in the airways, causing the asthma attack. There are a few methods involved in controlling asthma. Some of these methods are tracking asthma effectively, training healthcare professionals, and educating individuals with asthma and their families as well as medications. When one is diagnosed with asthma, it is important to keep track of what your triggers are, your peak flow meter readings, asthma attacks, how long the attack lasted, and how it was treated. By tracking this information through a diary or log, it can help prevent attacks and also assist the doctor in their medication treatment plan. If a healthcare professional could be better trained on asthma and its effects and how it can be controlled, it would be much more beneficial to the patients that he or she sees. There are many educational tools available out there for doctors, nurses, medical assistants, etc. It is as easy as getting on the computer, going to the website for Center for Disease Control and Prevention. This informative site provides case studies, slide presentations, information on vaccinations, medical organizations that specialize in respiratory diseases, and quick reference guides. Also, doctors need to be up to date with their asthma training, including knowing the latest medications as well as outdated medication information. Kids, parents, and adults need to be educated if they have someone close to them with asthma. They need to be aware of the signs of the asthma attack, the triggers, and what they can do to help someone close to them should they ever have an attack. There are many support groups out there for adults and children with asthma. This information may be obtained via the internet or their nearest healthcare provider. There are two different types of medications that aid in control of asthma. Those medications are preventative and rescue. Preventative are also known as controller medication, help avert the symptoms of asthma if taken daily. Airways are less inflamed and less likely to react to triggers. It reduces inflammation, swelling, mucus production in the airways. Rescue medications, also known as quick relief, rapidly open the airways, letting more air come in and out of the lungs. They relieve wheezing, coughing, and shortness of breath. Rescue medications are short-acting, so they do not prevent inflammation in the airways, and they're used occasionally. In order to get a better handle on asthma, both preventive and rescue medications should be taken. An interview was conducted with Mahal Dalal from the Department of Public Health regarding asthma's economic impact, asthma awareness in schools, and reducing the burden of asthma prevalence. In interviewing Mahal, it was determined that the impact of the environment has affected people diagnosed with asthma. 1 in 11 children have asthma. Asthma prevalence was higher for males than females from 2006 to 2009. In comparison to other ethnic groups or races, Hispanic students' asthma rates were higher. 1 in 2 children miss at least 1 day of school each year due to issues with asthma. When a child is diagnosed with asthma, the healthcare provider comes up with an action plan. The action plan includes all medications with instructions and when and how they should be taken. It helps with the control of asthma and its symptoms. Mahal didn't know much about the education of students in schools on asthma, but stated the National Asthma Control Program does currently fund various school-based asthma control programs as well as training. Also, the state provided programs such as Airways for schools and Breathe to Achieve to educate students on managing asthma on their own. There are geographical environments that are conducive to those living with asthma. A person with asthma changing their geographic location, removing themselves from triggers could be beneficial. It depends on the individual's specific trigger on whether changing climate would help. For example, if a person has exercise-induced asthma that is worse in cold weather, a warm climate may be an advantage. Alternatively, if a person's triggers are mold spores, which may be more prevalent in warm or humid climates, a colder climate may be beneficial. In conclusion, there is no cure for asthma or any documented research to find a cure. It is a lifelong illness that, with the proper medications, can be controlled. There are support groups, control programs, and websites that people can access regarding asthma. There is no excuse for people not to be educated on this illness. With the proper educational tools and resources, people will be more aware of asthma and all of its triggers so that an attack can be prevented. Thank you very much, and I hope you got something out of today's report. Thank you.